or the forum member of Bellicapelli. My strategy to deal with repair patient who had previous surgery with a lot of scar tissue in the recipient area, we try in general not to create the same density to give the blood supply the possibility to regrow in this area, and prefer to do a second smaller session as a touch-up session to get the final result. So we try not to do it in one session. Sometimes we need the second session to get the good result. In my office we perform some months more than 50% in FOE technique. I think the FOE is a really good technique for minor hair loss pattern like Norwood 1, 2, 3, sometimes even 4 with a good donor area. We try to avoid the strip in each case of a patient which has the age younger than 30 years old, or which have some problems from the skin. If we see some problems with the structure of the skin. But in general we said 30 years is a good age to think about strip or FOE, but everybody under 30 is in general a good candidate for an FOE. Sometimes we do combined treatments. That means in the same case we make a strip and we take also some units out via the FOE technique. If you compare those units, you see a difference in the quality of the units. That means the follicular units from the extraction side, they have missing connection tissues. So the hair roots, they do sometimes these follicular units play. They're much more difficult to insert, and because of the lack of this connecting tissue, they are more sensitive. If you know this, you have to find a way how you can deal with the more vulnerable follicular units. And a perfect way is to do this intermittent follicular unit extraction. That means just to take out 500, 800 or 1000 and to insert them directly. And if you do it like this, you can have the same density like with the strip. In general, I said always during my consultation, the FOE has something about 5% less regrow. I don't have any experience with A-cell. I was at the Congress in Anchorage now this year where I bought E-cell for some special client who want to get a treatment with A-cell. My personal opinion in the moment, without any knowledge about the details, is that it can be a very good option in scar corrective cases. And at the moment we try to coat our follicular units from the follicular unit extraction cases in A-cell, and hopefully we see some positive results. Patient with a diffuse thinning, I personally think we have to divide them in different groups. We have to see if it's really a high degree of miniaturized hairs. That means there's nearly only vellus hair left, which don't have any effect for the density. Then my strategy is to redensify the whole area as close as possible to give a nice natural result. If it's a diffuse thinning with a very low degree of miniaturization, I think one strategy could be to first start a medical therapy, for instance with finasteride, to see what happens with this thinner, finer hair, if the miniaturization is reversible, or if we get a stabilization, and then I prefer to treat them more conservative, not too aggressive.